What are trauma-informed de-escalation techniques? Have you ever wondered how to effectively support someone in emotional distress, especially if they have experienced trauma? Trauma-informed de-escalation techniques are essential strategies that help reduce emotional or behavioral crises in individuals who have faced trauma, including those with post-traumatic stress disorder. These techniques focus on understanding the impact of trauma on behavior and prioritize creating safety, trust, and emotional regulation rather than punishment or confrontation. One of the key elements is creating a safe environment. This means establishing both physical and emotional safety. It involves minimizing triggers that reminded individuals of their trauma, maintaining a calm and predictable setting, and ensuring that the person feels secure and respected. Recognizing trauma responses is also crucial. Behaviors such as aggression, withdrawal, or noncompliance may stem from trauma rather than intentional misconduct. Understanding this helps caregivers avoid judgment and punitive reactions, which can worsen the situation. Using calm and compassionate communication is another vital technique. Speaking in a gentle, non-threatening tone and using clear, simple language can make a big difference. Validating the person's feelings and avoiding yelling or commands can help prevent escalating fear or defensiveness. Building trust and connection is essential as well. Establishing rapport through empathy and active listening allows individuals to feel understood and supported, which can reduce their distress and resistance. Offering choices and empowerment is also important. Allowing individuals some control over the situation, such as providing options or asking for permission before taking actions, supports their autonomy and helps reduce feelings of helplessness. Employing grounding and self-regulation techniques can help individuals focus on the present moment. Breathing exercises, sensory input, or other calming strategies can significantly reduce emotional overwhelm. It is also important to avoid physical restraint or coercion unless absolutely necessary. Physical interventions can re-traumatize individuals with PTSD. Trauma-informed care favors non-physical methods and uses restraint only as a last resort, with trained personnel. Collaborative problem-solving is another effective approach. Engaging individuals in identifying solutions or next steps supports their resilience and recovery, rather than resorting to punishment. In educational settings, these trauma-informed de-escalation techniques are integrated into broader trauma-informed care practices. Schools promote safe, structured, and predictable environments. They train staff to recognize the impact of trauma and respond with compassion and restorative approaches instead of punitive discipline. This includes forming multidisciplinary teams to support students and adapting discipline policies to be trauma-sensitive. From the perspective of PTSD, trauma-informed de-escalation techniques respect the complex ways trauma affects cognition, emotion, and behavior. They focus on safety and empowerment while fostering healing relationships. These techniques are essential for supporting recovery and preventing further psychological harm. Overall, trauma-informed de-escalation techniques are evidence-based practices aligned with current medical and psychological understanding of trauma and PTSD. They emphasize safety, empathy, and empowerment to effectively manage crises while supporting long-term healing and resilience.